Next slide. The traditional way to look to Ayurveda in general public's mind is it is something slow. We started off with Vidyagni for changing that perspective and from slow to fast. Definitely people want it fast, not only in smaller cases, but even in critical care. So where we can have this fast action for different problems and how we can work it out. That is what I am going to explain here. So, of course, my tool today is Vidyagni, non-pharmacological interventions. Why non-pharmacological? Because that is something which you can do within your OPD quite easily. And if I don't have a lineage का मतलब है आप किसी परंपरा से नहीं हो. जैसे तायडे सर सिखा रहे तो उनके सीखने वाले स्टूडेंट है वो तायडे सर की परंपरा होगी. वैसे ही धर्माधिकार सर जो है उनकी परंपरा से कुछ लोग चरक और उसके साथ में चिकित्सा कर रहे हैं. मैं तो रस शास्त्र की परंपरा से, हमारे गुरुजी थे अन्ना शास्त्री दातार नासिक वाले, तो वहां से हम लोग आगे आए हैं. लेकिन ये चीज जो है ये हम अलग तरीके से क्यों करना चाहते हैं. आप किसी भी परंपरा से हो, आपकी दवाइयां आप आपकी तरह से यूज करो. आयुर्वेद सबके लिए है, कम बुद्धि वाले के लिए भी है और बहुत बुद्धि से उसके ऊपर कुछ अपना खुद का सोचने वाले हमारे दिलकुश सर जैसे भी है कि जो किसी छोटी सी चीज से, और ये तो चीज पूरा मित्तल जानता है कि शास्त्र का अर्थ कैसे लगाया जाएगा, ये तायडे सर से सीखना है. तो इन सब के जैसे हमारे पास कोई गुरुजी है तो भी अच्छा है, अगर नहीं है तो भी आपको ये नॉन फार्माकोलॉजिकल मालूम होना जरूरी है. सो व्हेन वी आर टॉकिंग अबाउट क्रिटिकल केयर, वी हैव टू अंडरस्टैंड वी हैव 3 stages. First is something which is related to pranahara, something which is going to be life threatening, and their first motive, and everybody knows we need admission, we need hospitalization, we need ICU, and we in this era have to do a lot. But when it is related to Tivra Vedana, we can do something, and I am going to talk about that. Then something when the patient is stabilized and still you have to continue. So at present our role in critical care has come up from stage 3 to stage 2, and with the new generation Gen Z coming into it, definitely at some point we'll be working in stage 1 also. And we have some doctors like Dr. Dikshit from Goa, and there are a lot of doctors who are working for ICU patients also. So that is another level of critical care where we are using at second stage Ayurveda. This is the second stage, Tivra Vedana. We are using it in some conditions like renal colic. We are using it in Tivra Shirashur, just like the previous case which we saw about meningitis. There are a lot of migraines also. So anything related to pain, we can definitely give patient little bit relief. And when it is critical care, I'll tell you one simple thing. If I get a small kid, maybe 3-4 years kid, and he is crying continuously, for his mother, the condition is critical. Do you agree with me?
Yes, sir.
Kids fever going to 102 is critical condition for that parent. So we don't have to think what is critical. Something which is critical to the patient and the parents is critical. So in such situations, any pain, पेशेंट आपको आके बोलेगा कि सर आपका शास्त्र जहां पे वहां पे रहने दो, मुझे अभी यहाँ पे पेट में दर्द हो रहा है, कुछ करो. So in such conditions we have some solution. And these solutions we have to understand are very simple. Take a small needle, 26 number needle, check the point where there is pain, put it there and apply heat. That's it. So it is that simple. So whenever you are having any patient in stage 2 of critical care, what you need is hardly a small needle and some heat application method. It could be Agni Karma, the traditional way, or the way we are using it in Vidyagni with a Vidyagni yantra. Your pain is immediately taken under control, then you can diagnose, then you can give treatment as per your parampara, then control him, because we are not giving him total systemic relief. We are giving him just a temporary relief so that you can think. Patient will have trust in you. And let me be very frank with you, and maybe you will also be very clear on it. Ayurvedic fraternity has lost faith of patients as their first choice of treatment. And that has happened over last 80-90 years or maybe more. And that faith is regained through working in this second stage of critical care, giving them relief immediately. And of course, whenever there are systemic problems, my personal experience is Jwara Chikitsa is the best line of action in any kind of disease which is related to systemic problems. So you follow Langanam, Swedanam, Kalo in any patient. Along with that, give medicines whichever are in your parampara, and you are going to reach to the diagnosis in due course and going to get the results. So what we are talking about here is critical care, non-pharmacological. So I'm not going to talk about medicines right now. It can be a good source of control of pain in sports injuries, sports pain. It is regularly used for visceral pain. It could be appendicitis, it could be renal colic, it could be cholelithiasis, anything related to visceral problems. Just a single needle is going to help you. Anything related to your sinusitis, migraines, anything with the back or knee, the musculoskeletal problems, you name it and you have immediate solution. And as we can see here, I'm showing you pictures which are generated on AI. Let me be very clear. And as a doctor, we have to understand what's happening around. And AI is something, or your mobile is something which is going to be your tool to get a little bit ahead. So these pictures are showing different things in the same frame. On the right side, what you are seeing is what we want. It is Vedana Upashay. Patient wants Vedana Upashay in critical care stage 2. We have to give him mobility. We have to give him something which he wants, and that is relief. And all this has got some protocol. How to treat the patient, how to get him out of his problem immediately. And we have proven it in Yella Medical College itself, where we treated 1,000 plus patients in single day, and they got 72. तिवारी सर उसके खुद एक पार्टिसिपेंट थे और अपने चश्मदीद गवाह जैसे बोलते हैं ना, तो we have done it in exactly 8 years back, 2018 7th April. So we can say that this is something which is easily replicable, easily provable. So principles of critical care. On one side, Agni Raksha, Srotas Shuddhi, Manova Srotas Oja, and Dhatu Samya. All these things are part of the treatment. But when we come to critical treatment, this is something which we are trying to work out. And as a simple general practitioner, for me, when word critical care comes, it lands me directly into ICU. But in GP practice, generally we get patients who are within bracket of critical care level 2, and that number is around 80%. So if we can establish trust that you can treat him, these 80% of patients won't land into ICU, and then the case is not in your hand. You can bring him back into your own, I will say, stadium or into your own court by using non-pharmacological interventions like Vidagni, and the patient is getting out of his problem in your clinic, will give you satisfaction, and of course it will also give you vitamin M. Vitamin M शिवाय काहीच नाही आहे ना, and that comes only in critical care management in good way. डॉक्टर के पास नहीं तो कौन आएगा? लाइफस्टाइल मैनेजमेंट, डाइट कंसल्टेशन, उसके लिए तो बहुत लोग बाकी है, लेकिन पैसा तभी आएगा जब उनकी जरूरत है और आप उसे पूरा कर रहे हो. So I feel this is something which we have to understand. The vision has to be, we have science, we have to prove it, we have to get it to the patient, we have to get them out of their problem at early age. And as sir had given me time, and I had to complete my full program within 10 minutes, I think I am within my time. Thank you.